Head and neck cancers are the 7th most common cancer in Australia and 14th most common cause of death, with human papillomavirus-linked oropharyngeal cancer increasing.
Victorian Tumour Summits works to improve patient experience and outcomes in Victoria through greater consistency in cancer care.
The Head and Neck Cancers 2018 Summit prioritised variations in head and neck cancers treatment and outcomes in Victoria for investigation and action.
I'm Stephen Tudge. I'm an ear, nose and throat head and neck surgeon. I'd like to see improvements in the treatment journey and outcomes for patients with head and neck cancers.
I'm Janelle Oliger and I'm a dietitian. I want to see comprehensive care for all patients with head and neck cancer before, during and after treatment.
I'm Lisa Leukemia. I was diagnosed with head and neck cancer in 2015 and I think we can improve psychological and peer support for people like me.
One of the ways we can help achieve best outcomes for our patients with head and neck cancers is by making sure they receive multidisciplinary care. This means all specialist health professionals involved in a patient's treatment and care come together at a multidisciplinary meeting, called an MDM for short. MDMs discuss the best treatment for each patient's cancer and how to help patients regain the best function possible in the long term.
Treatment and care are then provided by all relevant members of the MDM, including dietitians and speech pathologists. Patients should receive a dietetic and speech pathology assessment before treatment to identify nutrition, swallowing and communication issues early. Patients also need a dental review before radiotherapy.
Summit data showed there were lower rates of documented MDM discussion in 2 regions of Victoria, and the proportion of patients with malnutrition receiving advice from a dietitian may be lower at rural treatment centres. We need to make sure that all MDMs have specialist health professionals who can attend either in person or by an audiovisual link.
This includes dietitians, speech pathologists, special needs dentists and nurses with appropriate expertise, as well as other health professionals with expertise in assessing and managing patients' psychological and social needs.
Summit data also demonstrated poorer survival for patients with oropharyngeal and base of tongue cancer who were treated with radiotherapy only. This is important information for MDMs to consider during treatment planning for these patients.
Existing and new public and private centres need specialised and experienced dietitians and speech pathologists to care for patients with head and neck cancers before, during and after their treatment. New centres should include dietitians and speech pathologists at the service planning stage. These dietitians and speech pathologists require specialist skills and knowledge and need training and support from those experienced in the field.
It's important to outcomes that patients with head and neck cancers are managed at a centre that can deliver comprehensive care. There is consensus from the Head and Neck 2018 Summit that it is not appropriate to treat patients at centres with less than 10 patients a year, and a recommendation was made that smaller centres develop networks with larger centres.
Many patients have treatment outside the region where they live. Nurses, general practitioners and public and private dentists can help by referring patients with a suspected head and neck cancer to the nearest MDM specialist. This specialist will arrange at the MDM to have the best treatment plan delivered at the nearest appropriate centre.
An MDM treatment plan balances treatment with the patient's own preferences and needs. Nurses, GPs and dentists can find a list of all MDMs on the ANZ Head and Neck Cancer Society website, and Dental Health Services Victoria have a demonstration video for dentists on oral cancer examination.
Patients need greater peer support. Beyond 5 is a national head and neck cancer charity. It provides evidence-based information and the website details available peer support groups in Australia. There is also the Cancer Council 131120 line for information and support.
The Australian recommendation is a maximum 6-week timeframe from finishing surgery to beginning adjuvant radiotherapy. During the period studied, only 37% of Victorian patients started adjuvant radiotherapy within this timeframe. Only 66% of rural patients treated locally start primary radiotherapy treatment within 8 weeks of diagnosis.
If radiotherapy is the primary treatment, the recommendation is a maximum of 4 weeks time frame from decision to treat with a curative intent and 2 weeks for palliative intent. We need to investigate barriers to timely treatment, especially for our rural patients.
These are the prioritised variations for head and neck cancers care in Victoria, with patients, dentists, nurses, general practitioners and health professionals working together, we can improve cancer care. Consistency in care gives your patient the best outcome.